Today I want to talk about the opioid epidemic and what we can do about it. Welcome to another episode of Dr. Simone Says. My name is Dr. Simone Eastman Yuan. I am a medical doctor with sickle cell disorder, and I am also a best-selling author. These days I like to spend my time making sure that every sickle cell survivor is also a sickle cell thriver, because it matters to me that you live well. I know that with our plight of managing our sickle cell crisis pain, and in the current environment, it is getting bad out there, and I've heard a lot of feedback from that, and I've had a lot of people request that I do a video on this because of feeling like they don't know what their options are. And I know that I was recently hospitalized, and one of the things that came up was the fact that a particular narcotic that is used to control tremendous sickle cell pain is in scarcity in the United States, in part because it was made it was made in another country, and from my understanding, there was a natural disaster in that country that caused a lot of destruction and caused a lot of their laboratories and centers to be non-operational, and as a result they are not able to produce at least in the same amount that particular narcotic analgesic. And so unfortunately what's happening is that it is now being restricted, understandably, but it's still unfortunate for us, for end-stage cancer pain. Now, we have been told over and over that the sickle cell crisis pain is like end-stage cancer pain in intensity. Whoever came up with that, figured that out, I don't know. But they have noticed that the same amounts and the same kinds of pain medication that manage end-stage cancer pain are what respond to sickle cell crisis pain as well. And so we're in the same boat, but because of wanting to provide compassionate care to the end, they are restricting that medication for cancer patients. And so sickle cell patients are finding themselves in deep want because they don't have access to some of the only medications that actually treat their sickle cell pain. I don't know what we can do about that on a Congress level. I can only say that in the meantime, there are some things that we need to think about in terms of how we manage our pain. My first order of prevention, as I am sure is yours, is try to not get sick in the first place. However, I know that there are some triggers that just, it is what it is. If you know there's a cold spell or it's the winter, it seems like we all hibernate for the winter, or we're all in the hospital for the winter, or at least we're home in a lot of pain and trying to manage it at home. And so there are things that you just can't get around. So what do you do for those things? My first thought is that we have to understand why we're having the problem. Okay, we had a mismanagement of medications, and the wrong group of people are getting punished for that. This medication got misused as a street drug or for lesser types of pain and caused grave addiction because of that. If you are truly treating pain and only pain, the studies have borne out time and time again that you do not become addicted if you are only treating pain. It is if you take the medication and you don't have that level of pain that you then can create a euphoric state, and you can like that and come back for more and create addiction that way. But so we are we are the victims of that opioid crisis when we are not necessarily the ones that will become addicted to the medication because we have honest to God pain. So what do? My first thought is to go to your primary care doctor, or even just decide for yourself. Do you feel like your primary care provider is comfortable managing your sickle cell disease aside from the pain management? Usually the person that will be providing your pain medication is your hematologist, oncologist, or your pain management specialist. If you like your primary care physician and feel like, they manage everything else well, I would encourage you to then decide on getting a pain management specialist if you don't have one. If you're normally getting your pain managed by, say, your hematologist, and the hematologist is having a difficult time, you might want to consider a pain management specialist. If you feel like you can stand to get rid of your primary care physician, it doesn't matter to you as much, then you can try getting an internal medicine specialist as your primary care physician. And the reason why that is actually better is because they are trained for more acute issues and in-hospital type issues. And unfortunately, our issues kind of fall in that bracket. I don't know if you have a primary care physician, but most primary care physicians these days are so swamped with all of the, I call it first port of call patients, but everybody coming through the door. They're often termed the gatekeepers of medicine because everybody comes in. And so they're dealing with very routine things to very life-threatening things like your disease. You may not be in the best hands for that because they're being allocated 20 minutes per patient for visit, and a lot of our issues are quite life-threatening and really need to be sorted out. With internal medicine, they often get about 40 minutes to visit with a patient because of the complexity of their disease. And so that is why I'm saying it might be better to get an internal medicine specialist on board to help you truly manage all of those other non-sickle cell things so that they don't become triggers of your sickle cell disease. Many things are triggers of your sickle cell disease that you don't know about. Any stress on your system that is not being addressed could become a potential trigger for your sickle cell disease. And so it's important that you have someone that's really managing all those other aspects and well, so that they do not become triggers. If you are okay with your primary doctor, if you're okay with your hematologist writing your prescription and you feel like that hematologist has been comfortable and no problems there, great. But if not, you may want to again refer to a pain management specialist because that's all they do. And here's the thing, a lot of times it's like people have their specialties, right? And within their specialty, if they're the hammer, everything is a nail. So if you go to a pain management specialist, that's what they do best. They manage pain. So you are more likely to have your pain managed than with someone who is a hemonc person that may be concerned more with, all things hematological, sickle cell included, but they may not be a sickle cell specialist per se. And so you may find yourself with someone who might be too spread thin to really be concentrating on managing your pain. And so your best bet is to find someone who will do just that. Ideally, if I could choose, I would pick an internal medicine person as my primary, and I would pick pain management specialist and a hematologist. I would go to the hematologist for all things sickle cell, and then for my pain management, I would have a separate compartment and go to a pain management specialist. Now, here's the thing. A lot of times, if you consult even with a pain management specialist recommended by a hematologist, they will make a custom fitted regimen for you in terms of pain management, and then send you back to your hematologist. So you may not have to go to that pain specialist as yet another person that you go to. It may just be someone who makes sure that that aspect of your care is tightly monitored and well monitored. And then whenever you need them, you could go back to them, but otherwise you could be with your hematologist. That's just a thought. The other thing I wanted to tell you about is your medication. Now, a lot of people don't realize this, but you'll get your medication, and some of you are very proud of the fact that, you didn't use all of it. They gave you a month's worth of medication, or it was supposed to last, 2 months, and it lasted 3 or 4 months. But the thing is, you don't tell people that. You just go in, you do your follow-up, and you say, well, I don't need any medication, so I won't say anything to them because I don't need any medications. No, tell them, I don't need any medication because it lasted longer, because I'm trying really hard to manage my pain. And so it becomes something stuck in their head that, hey, this is a person who is really trying to manage their pain with non-narcotic analgesics, and it is lasting longer than it was intended, which is a good thing. That shows you to be the non-abuser patient that you really are. Not to say if you use all your medication that you're abusing, because I know most times the medication that's given is barely enough for us to get through, and so we will not necessarily have extra. But if you do have extra, and that is an argument that you can use, why not use it? Use it to the best of your ability, and let everybody know, from the nurse, the person up front, in conversation, whatever. Let the whole medical staff know, like, this is so crazy. I am, something good's happening because I'm not using my medications. Or I still have leftover medications and I don't need another prescription. Let them know that. Establish yourself as the legitimate patient that you have always been, if you have the means to do so. And then the last thing I want to mention is regarding gosh, there's one other thing I was going to mention. Let me see if I can oh, there we go. Ask them, the one other thing I'd like to mention, ask them if you were to go to a pain management specialist or even your hematologist, ask them, you know, and this is only if you're getting pushback with your medications, ask them, if you were me, what would you do? What else would you try? Because it's not like I just want narcotic analgesics. I want anything that would help my pain. If you give me ketchup and it helped my pain, I would take it. And be prepared that if they say, you know, well, I was actually thinking that you might have a component of nerve pain and maybe you should try some lidocaine patches. Or, oh, I was thinking you might have a little bit more inflammatory pain. So I was thinking of, you know, be open. You know, the side effect panel for a lot of the narcotic analgesics that we take are not good, but we take them because we know we have to take them. So please don't use this time to go, oh, I see that this other medication causes all these, you know, 1,000,001 side effects. You're already on a lot of medications that are causing terrible side effects. So it actually would be helpful to be off of some of those. Now, I'm not saying that you shouldn't complain about any of the side effects, but what I'm saying is don't look for any little reason to not try the medication just because it is not a narcotic. Be open to trying something else. It does two things. One, it shows them that you are willing to try and that you are committed to pain relief and using anything, not just narcotics. But it also opens the door for the possibility that you might try something and like it, that you might actually get good results from something, and you might like it better than the narcotic analgesic that you're using. Now, here's the trick though. You don't want them to pull your pain medication. You do not want them to pull your pain medication before you know that something else is working. So you say to them, I would like to try something. I am just afraid that it may not work as well and leave me in a bind. So how about we do this? Could you still please prescribe my medication? And I will also take the prescription for that medication. And I will try that instead each time for a little while to see if it helps, because I really would like for something else to help. But if it doesn't help, at least I will have the security of knowing that I don't have to find an emergency room or a doctor in the middle of the night because I didn't have as much of my medication because I went down too prematurely. That's how you say. And so then they can give you your full prescription, but they will be happy to give you, you know, your regular prescription, but then this other thing to try if you are open to trying it. Because they usually don't have a problem with non-narcotic medications and prescribing those. They usually have a problem with narcotic medications. So if you're asking for something else that's a non-narcotic and willing to try it and just wanting to see if it helps or not, get your regular meds as your security blanket and get a prescription of that new medication and see if it helps. Because you never know. That's actually how I figured out that one of my medication was going to be helpful. I actually ended up trying it for something else and found out that it lessened my pain and was able to come down and actually off of one pain medication because of that. So don't write everything off. Just be open to that. But like I said, in the meantime, go and sit and ask yourself, do you feel like your health is being optimally managed? And if it's not, consider asking for an internal medicine specialist as your primary and if you need to have your pain management optimized, going to a pain specialist, if only for a few consult visits, and then back to your hematologist. Okay, I hope that was helpful. Until next time, this is Dr. Simone says. And please remember, you are a sickle cell thriver, not just a survivor. If this episode benefited you in any way, I will ask you to please like this video, subscribe to my channel, and share the link with one other person as your good deed for the day. Have a good day.